Slides identified by naked eye, eyepiece, and confirmed by low power. Adult lung examined by eyepiece and low power. Fetal lung examined by eyepiece and low power. Pituitary gland examined by eyepiece and low power. Kidney examined by eyepiece, low power, and high power for examination of the cortex. Slides of male genital system. Testes examined by naked eye, eyepiece, and low power. Spermatic cord examined by naked eye and eyepiece. Prostate examined by naked eye and eyepiece. Section of the penis examined by naked eye and eyepiece. Slides of female genital system. Ovary examined by naked eye, eyepiece, low power, and high power for examination of mature Graafian follicle. Placenta examined by low power. By naked eye and eyepiece, adult lung has a spongy appearance. By low power, it has empty large-sized spaces, alveoli, and the presence of bronchi with cartilaginous plates and bronchioles with well-developed muscle layer. Fetal lung, by naked eye and eyepiece, appears lobulated red in color. By low power, it has collapsed alveoli, congested blood vessels, and very small bronchioles. By naked eye and eyepiece, pituitary gland is formed of two lobes. The dark blue anterior pars distalis appears impressing the pale bars nervosa, with occasional cleft in between. By low power, pituitary gland consists of two major parts or lobes separated by cleft. Anterior pituitary or adenohypophysis appears dark in color and is composed of groups of cells separated by blood sinusoids. And posterior pituitary or bars nervosa, which appears pale in color and is composed mainly of nerve fibers and supporting cells called pituocytes, separated by fine blood capillaries. The kidney. By naked eye and eyepiece, the section is kidney-shaped, with outer dark cortex and inner pale medulla, composed of multiple pyramids. By low power, renal cortex shows glomeruli or Malpighian corpuscles, proximal and distal convoluted tubules, and the lobe of Hell, while renal medulla contains lobe of Hell and collecting tubules. By high power, renal cortex shows glomeruli. Each glomerulus is made of Bowman's capsule and a tuft of tulgous capillary lobes, which is called glomerulus. There is also proximal and distal convoluted tubules and the lobe of Hell. Proximal convoluted tubule has a narrow lumen and is lined by few pyramidal cells, 3 to 4. The cells are acidophilic with basal striations and distinct brush border, while distal convoluted tubule has wide lumen and is lined with many cubical cells, 4 to 8. The cells are acidophilic with basal striations and indistinct brush borders. Slides of male genital system, testes and epididymis. By naked eye, the epididymis appears small at one side, while the testis is large rounded section containing many small circles seminiferous tubules. By eyepiece, epididymal tubules are cut in different plans as they are highly convoluted. The tubules contain sperms, while the testis on the other side is seen containing many seminiferous tubules. By low power, epididymis appears as multiple white tubules lined with pseudostratified columnar ciliated epithelium and show sperms in their lumen, which appear hair-like. By low power, the testis shows many seminiferous tubules lined by highly specialized stratified epithelium, spermatogenic epithelium. Leydig cells or interstitial cells are seen between the seminiferous tubules. Spermatic code. By naked eye, it contains many structures. By eyepiece, it shows transverse section of vas difference, TS of striated involuntary skeletal muscle, cremasteric muscle, pampinoform plexus of veins. Other blood vessels are testicular artery and vein, together with some nerves. Prostate. By naked eye, it appears as a large kidney-shaped section, showing transverse opening of urethra, prostatic urethra. By eyepiece, it shows prostatic urethra in the center, surrounded by acini of variable sizes and shapes, arranged as mucosal acini, submucosal acini, and main acini under the capsule. Section of penis. By naked eye, it is a rounded section with characteristic shape. By eyepiece, it is covered by skin and is formed of 3 corpora of erectile tissue, 2 dorsal corpora cavernosa and 1 ventral corpus spongiosum traversed by penile urethra. The 3 corpora are surrounded by a layer of connective tissue, fascia penis, rich in elastic fibers.
Ovary, examined by naked eye, eyepiece, and low power. It is an oval section showing ovarian follicles at different stages of development. Growing follicles are small size, present under the capsule, while mature Graafian follicles are large size, thin wall vesicle containing fluid, liquid folliculi, and an eccentric ovum. Sometimes corpus luteum is detected in sections.
Placenta. By low power, there is a number of chorionic villi of different shapes and sizes, each consisting of a central core of connective tissue containing fetal blood vessels and an epithelial covering, trophoblast, separated from each other by intervillous spaces containing maternal blood.